Good evening, everyone. I want to welcome you to tonight's HFA Families webinar. My name is Sandra Wells. I'm a program manager for the Hemophilia Federation of America. Also joining us tonight is Michelle Berg, HFA Programs Director. Just wanted to say thanks for attending. We know this is a difficult time of night for most families, so we appreciate you being here. Before we get started, I'd like to go over a few webinar pointers and helpful hints. Tonight's webinar will last approximately 1 hour. We welcome your participation and questions. However, your audio will be muted by our webinar system for the duration of tonight, as this helps eliminate background noises that may disrupt the presentation. If you have a question, we encourage you to use the question box on the bottom right of your console panel. I will then pass these questions along to our speaker. Throughout tonight's presentation, there are several audience poll questions. When these questions appear on your screen, you will have the opportunity to answer those anonymously, and then we'll share the audience's feedback. And then finally, just want to thank Novo Nordisk and AHF for their support of our Families program. And with that, I will introduce our speaker. Tonight's speaker is Dave Robinson. He's a PhD and licensed and practicing marriage and family therapist and director of the Marriage and Family Therapy program at Utah State University. He and his wife, Jamie, have 5 children, 3 sons and 2 daughters. The oldest and youngest sons both have moderate factor IX hemophilia. Dave travels the country sharing his experience and expertise with families on behalf of the HFA Families program. And with that, I will turn it over to you, Dave. Thanks so much for presenting for us tonight.
Thank you. Good evening, everybody. I prefer live audiences, but I also like the fact that we can reach people where they are. So happy to be able to do this and spend some time with you this evening. So as you can see on this slide, I can't fight this feeling, depression and anxiety. We'll be talking about some of the common concerns that happen when you're dealing with significant stressors like having a bleeding disorder in your family. One of the disclaimers I want to note at the bottom of the slide there is if you find that the things that we're talking about are really hitting home for you and there's some significant stress going on, we'd really encourage you to visit with your local doctor or get in to see somebody right away, especially if there's some concerns about your safety or the safety of anybody in your family. So like Sandra said, I do have 5 kids. 2 of them do have moderate hemophilia. One's 21 and one's 10, so we've had the full experience of dealing with the stress and anxiety that comes with kids as they grow through the toddler age to where they are kind of off on their own, and you wonder if they are really taking good care of themselves. So that gives a little bit of background about me, and we'll continue forward. We do want to, as she said, thank Novo Nordisk and CDC collaborative partners for helping sponsor this. So I will talk a little bit about the common concerns, the kind of the everyday colds of mental health and emotional difficulties that we'll talk about today. Overview of who we are as individuals, especially those of us who have bleeding disorders in our family. And then, more importantly, talking about some solutions and strategies to help us cope better with it, because just because we're struggling doesn't mean that we can't find ways to thrive in the situation that we're in. Because truthfully, in the end, we don't have a lot of control over some of the struggles that we have, but we do have control over how we react to it. And so our goal is to figure out better ways to deal with the situation, because even if you're having a really difficult time at this point, shutting down or just really getting angry about the situation doesn't make the process easier. And the other part is those of you who are dealing with your kids who have a bleeding disorder, we kind of have to be the ones to be stable. And so it's really important that we strive to do that. So we'll start with a poll here. And the question is, what is your current level of stress? And choose one of these, and we'll turn the time over to Sandra to get the poll done.
Yeah, so we'll launch that poll right now and give everybody just a few minutes or a few seconds to answer that. And as I see those votes coming in, we'll give a few more seconds here for the rest of the audience to vote. Let's do it. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. See what we have for results here. And 50% of our audience says that they feel like their current level of stress is manageable. A quarter of the audience feels like it's high, and 25% say that it feels like it's out of control right now.
All right. Well, and the one thing about this is on any minute it can change with all of us. So hopefully those of you who are high and it feels out of control, there will be some things said today that will help you find ways to decrease the stress a little bit. And those of you who are managing it pretty well, keep it up, and hopefully you can find some strategies to keep it under control too. So a few things that I want to cover here is, why do we even worry? Why is this a problem? It's not because we're bored. It's not because we think it's fun. It doesn't fix things at all. But we worry because we care. And I think that's something that we need to focus on a little bit, that, we care, and that matters. And it's better to care about somebody and care about what's happening and have that cause some stress than to not care at all. You've probably all come across individuals who really deal with life by not caring about anything, and they're just not very happy people in general. So sometimes we have to put into perspective that some of the stress that I'm having is normal and it's okay, and the rationale behind it is pretty clear why we do it. The other thing is, why do we get sad? Too much stress does it to a lot of people. Relationships can make us sad. Maybe our spouse or partner isn't doing very well or isn't very nice to us. Maybe, those of you who have teenagers know that relationships with teenagers are variable at best. Finances can be a stress, especially with a bleeding disorder. We had 2 boys infusing factor. I think we figured out on last weekend it was $47,000 or something that was spent on factors. So finances can be a big issue. Health, of course, is a reason why some people get sad, and loss is definitely a reason why we're sad. So just kind of put that in context of why some of these things that we'll talk about play a role. So stress is something that sometimes we forget that we have a little bit more control over, at least how we deal with it. So when you think about this, how do you think about stress? There are a few options that I want you to consider as you're going through what your current view of stress is. Is it real or is it perceived? So, a real stressor is you're standing out in the savannah and a tiger's about ready to eat you. That's a real stressor. And sometimes perceived stressors are just as scary as that. You're not sure what's going to happen with your child with this bleeding disorder. Maybe inhibitors are playing a huge role in that. And so there's a reality part to that, and there's also a perceived part. And the perceived part is something that maybe we can do a little bit about, and we'll talk about that a little bit more as we go forward. The other thing is external versus internal stressors. We have, sometimes we just wake up in the morning and not feeling very well. And just internally, maybe you have a little cold. Like I was fortunate enough to wake up this morning with a little cold, so I apologize if I'm maybe sniffling. But sometimes things just happen inside our bodies. Versus external stressors, things that we don't have a whole lot of control over. And that's part of the problem sometimes, is we try to control things that we just don't have any control over. We need to focus that energy on the things that we can actually do to make a difference. It's also what we've learned to do. Our families do a lot to train us and teach us how to deal with stress. So if mom was a worrywart, or dad was a yeller, or grandma taught you to do something different, sometimes that's just what we do. And a lot of times we think, oh, I don't want to ever be like them, or I'm not going to do it that way, I'm going to do it differently. And then before you know it, 10 years later, you sound just like the person that you said you weren't going to be. So it happens also with stress, is sometimes people internalize stress and they just close it up, and other people talk about it and run and do whatever. And so I think it's good for us to take a step back and look at, how is it that you deal with stress, and what could you do maybe a little differently? And then the other part is poor recognition. Sometimes we don't realize how much stress we're under, and so that's where people sometimes end up having stomach problems, or they start having chronic headaches, or their shoulders are aching all the time, and they don't realize that this stress is just causing their body some issues. And so we probably need to recognize when stress is hitting us and actually use some of the strategies that we'll talk about today. So just briefly, I want to mention this, and I don't know if my pointer works on this, but I'll point and I'll tell you too. But as far as the human performance curve, the goal is to be in this optimal level where there's just enough stress, kind of manageable stress, and if you're in that level, that's where performance tends to be the best. And what we find is with too little stress, people get bored, they are not engaged in anything, they don't really accomplish much. And on the other end, too much stress or distress, performance goes down also. And so our goal is to try to hit toward the middle. How do we have enough stress to keep us moving and motivated and interested, but not too much stress to really knock us out? So let me just talk briefly about parts of our body that kind of manage how well we do with life. And they're set up, these automatic systems in our body, to take care of us. So we have the sympathetic nervous system, which is kind of the gas pedal. This is the fight or flight thing. So, if you see that tiger on the savannah, this is the one that's going to get your heart pumping, blood flow. You're not worried about digestion. You're just trying to get out of there. And that's pretty functional, right? And then the parasympathetic nervous system is kind of the brake pedal. This is where you take a break, you're able to digest your food, everything starts slowing down, and it's a way to kind of control what's going on inside of your body. Well, both of these, if they're on all the time, don't work very well. If you're chronically pushing on your gas pedal, you're always stressed, you're always worried, concerned about the next thing that's going to happen. And so you're always having that running. The other side is the same, the constant brake pedal. People just aren't motivated to do anything. And if you want to think about this, sometimes this kind of looks, the top one, the gas pedal, kind of looks like anxiety, and the brake pedal kind of looks like depression, right? Because anxious people tend to always be kind of on guard, ready to go, and people with the brake pedal tend to not really care that much. And so the goal is to utilize these systems in our body appropriately. So if we're constantly on one or the other, we need to find ways of turning that down. So either finding ways to get things moving a little bit when we need to, or find ways to calm ourselves down a little bit. So briefly, you can look through these. I'm not going to go through all of those, but these are common conditions that are related to stress and illness. And as you can see, there are plenty of them on there that can really cause issues. And they've done some pretty cool studies recently about stress and illness. And one of the things they've found is that people who think that the stress is damaging to them tend to have their bodies damaged. And those who feel like stress is a normal part of life, and this is something that I kind of signed up for, and so I'm okay with it, it's a challenge, it tends to not have that big of an impact on their bodies. So it's really important to kind of look at the way that you make sense of the stress that you have. And again, go back to that first thing that I talked about. If you're stressed because your loved one is having a bleed or having some other significant problems, maybe look at the positive side of that, is that you really care about them. And it's okay to be stressed about the situation that you're in, but you have to keep it low enough so that you can actually be functional, either for yourself or for your child. So one of the things that that play this role is, as you can see here, you know, what are the thoughts going through your mind when dealing with a bleeding disorder? You know, sometimes the first thought is that, you know, this overwhelming stress, or this is out of control, or some people think, well, it's not a big deal. Since my boys have moderate hemophilia, we deal with bleeds quite often, and I've been on focus groups where other fathers or mothers have kids with severe bleeding disorders, and they've never experienced a bleeding episode because they've been on prophylaxis their whole life. And so sometimes we have different experiences, and neither one is better or worse or whatever, but it's really about your experience that makes the difference and how you make sense of what's happening. And like I said earlier, the negative thoughts about what the bleeding disorder is going to do to us creates the issues with our health. So if we're worried about it, if we think this is too much, if we think that this stress is going to kill us, then we probably need to look at changing that thought process just a little bit to make things work a little bit better for you. So we're going to talk briefly, like I said, kind of the common colds of mental health concerns. And the first one being depression. Depression and anxiety are kind of sisters as far as being the common issues that we see most often. You know, depression is one of the #1 reasons why people seek mental health services. It's actually the leading cause of disability worldwide. So ahead of heart disease, ahead of diabetes, ahead of anything, depression takes people out of the workforce, out of their ability to function more than anything else. And so it's quite common. And many people in our group today have probably dealt with some form of depression. You know, and it's not, when you're in a stressful situation, that's not necessarily depression. It's when it hangs on for too long that becomes problematic. So some of the symptoms that we just want to think about, and if you're struggling with all of these, it might be a good time to go out and visit with a mental health practitioner or with your family practice doc or something. But this is where you have sad mood most of the day, nearly every day for about 2 weeks, where you start losing interest and pleasure in usual activities, that things that used to make you happy, they just don't mean anything anymore. You know, playing with the kids or doing scrapbooks or watching movies, whatever, kind of goes out. Sleeping difficulties is kind of different there, because some people, when they get depressed, they sleep all the time, or others can't sleep at all, and it doesn't really change the diagnosis, but something that you want to look at when you're struggling with your sleep. Now, of course, this is different when your child's in the hospital and you're not sleeping because of that, because that's a normal reaction. This is more when things are going okay, or the stress is too much that it's lasted for too long. Appetite can be an issue, again, positive and negative. Poor appetite or gaining weight can be an issue. And then loss of energy or great fatigue is another symptom of depression. And the final two are the negative self-concept, self-blame, and feelings of worthlessness or guilt. This is something that you want to, with those of you who may have a husband, or you may be older yourself and have hemophilia, sometimes you'll have health conditions that kind of mimic some of these symptoms of depression, but it's these thoughts about how you feel about yourself that kind of makes the difference in whether it's depression or if it's just a physical reaction, because, you know, there are plenty of pain disorders and things that are associated with hemophilia that can cause some of those symptoms on their own. Concentration can be an issue. And then finally, the last one is the recurrent thoughts of death or suicide, or maybe just a little bit less severe than that, just wanting to disappear. And that one, if anybody's struggling with that, we really want you to tell somebody today and get in to see somebody right away, because that's not how things have to be, and it's not a good solution for the situation, because there's plenty of treatments that are very effective for treating depression. Now, we'll switch to the sister condition, anxiety, and everybody kind of knows this because everybody's dealt with anxiety at some level, whether it be giving a speech in college or having to talk in high school or whatever. But anxiety as a condition is kind of that overall overarching feeling of worry, tension, feeling out of control, that intense fear, feeling on the edge, their concentration is out of control, sleep problems. Usually with anxiety disorders, it's a hard time with falling asleep, whereas with depression, oftentimes if there's sleep disorders, it's oftentimes having a hard time staying asleep. And then finally the physical symptoms, which are the reasons why a lot of people with anxiety end up at the doctor, because they think something's wrong with their body. And anxiety is a body condition, but it isn't necessarily a dysfunction, you know, headaches, nausea, sweating, stomach ulcers, those sorts of things, that's treatable by some sort of surgery, but something that you want to look at as you're going forward. So here's another poll. What's your biggest stressor currently?
And we're launching that poll now, so everyone can have a few seconds here to vote on what is your biggest stressor. Give it about 10 more seconds here. I'll give you guys a countdown. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. I don't quite see all of the audience vote, but I'm going to go ahead and close this poll and see what our results are. And our results say that 67% of our audience, Dave, say that work is their biggest stressor, followed by 17% for health and 17% for money.
All right. Well, that's good. Nobody put relationships down, so you guys are doing great there. And I also know there are some of you that wanted to mark all of them at the same level, but we've kind of forced you to choose something. So work is oftentimes a huge stressor because it takes us away from the people that we care about, but it's a necessary evil so that we can actually take care of the people that we care about. So there are lots of concerns and also that attitude about work that can play a huge role in how people are doing. So thanks for taking that poll. I'm going to talk about two more disorders. The first one is it's called acute stress disorder, and this is like the little sister of post-traumatic stress disorder. It's the same condition, it's the same experience, but it's a shorter duration. And the cool thing about acute stress disorder is that if it's treated and treated promptly, people are less likely to develop post-traumatic stress disorder. The problem is somebody will have a horrible experience and they won't get any treatment until, 4, 6, 8 weeks later when they're like, oh my gosh, it's not getting any better, it's actually getting worse. And so this is something, just a tidbit, if your child goes through a significant condition, or you or someone else, maybe kind of watch that. And if you start having these symptoms of difficulty sleeping, irritability, poor concentration, hypervigilance, so you're always worried about whatever happened to you, is that going to happen again, or do I need to stay away from that? Exaggerated startle response, anybody drops anything, you're jumping out of your shoes. And then motor restlessness, you're just kind of really fidgety. If you're having any of these symptoms and the situation that kind of caused a fear of death or a serious injury, that's a really good time to go in and see somebody, because there's some strategies that we use to help avoid the big sister of this, which is post-traumatic stress disorder. So just a little tidbit there on that. Post-traumatic stress disorder starts out, again, this has to be for at least 4 weeks, so that's why acute stress disorder oftentimes leads into post-traumatic stress disorder. It's the same experience, actual or threatens death or serious injury to yourself or others. So you've all heard of people that will go in after 9/11 and they were the people trying to rescue individuals, and they develop post-traumatic stress disorder because they saw these horrendous things. And it can happen also with parents that see their kids go through something horrific, or wives or husbands who see their spouse go through something. So something that you want to look at, and the treatment is pretty effective. Again, if you catch it earlier, the treatment's more effective, but there's some good strategies in dealing with this. And we all know about PTSD because of the war veterans that have dealt with horrendous things that they saw during war, and then they came home and really had a hard time with that. And I think the armed services are doing a much better job of treating these individuals now than they did in the past. So just something to look at, but also remember that this is just actual or threatened death or serious injury. So bleeding disorders can fit under that, because there's plenty of times when it feels like it's that way. So just kind of be vigilant. If those symptoms start coming, get help right away, and it's easier to deal with it. So one ways to deal with these stress disorders of whatever sort is that individuals who strive to not overreact, they learn how to self-soothe, and they focus on coping actually do better. And so again, this is when you take two people side by side, they go through the same experience. These are the things that make the difference for those individuals. Not overreacting, saying, you know, this is a bad thing that just happened. We're going to do the best we can. We need to calm ourselves down. And what can we do to make it through this? Those are the individuals that do better. And I'd really encourage you to think about that and talk about it as a family on how can we do a better job at utilizing these skills. So the other part that plays a huge role in dealing with a family member with a bleeding disorder is sometimes caregiver burnout can be a problem. You're always taking care of everybody. Moms are notorious for this because they're always trying to take care of their kids and work and everything, but they forget to take care of themselves. And we're going to talk about things that we should focus on that in the future. But the caregiver burnout, some of the symptoms is somewhat similar to the depression, blue, irritable, hopeless. Depression is actually more common in caregivers who are burnout. They tend to withdraw from family and friends. They lose interest in things. They're just emotionally exhausted and feel things wanting to harm themselves or the person they're caring for, which sounds so ironic, but when you're really burnt out, sometimes those things can come about. And so I just want to stress that you have to find ways to take care of yourself every day, and that really causes you the ability to avoid some of these symptoms that come out. And you may have already gone through this and you've kind of come out the other side, but take care of yourself every day, and you'll find that you're a whole lot better at coping with life in general. So here we go. It froze up on me for a second. So one of the things that can help us kind of figure out how everybody's coping with the bleeding disorder, either in themselves or in one of their family members, is kind of looking at these 4 quadrants of this circle here. The biological component on, you know, just the mere fact that here's what a bleeding disorder does to the body, and that's a pretty simple thing to look at. Also the psychological components of what's happening there. You know, how are we feeling about it? Are we having stress, anxiety, depression? What kind of social aspect do we have that helps us cope? And also the spiritual aspect. And so when you're looking at this, I'd encourage you to kind of divide up yourselves and your family and see how are we doing in each of these 4 quadrants. Maybe we're doing quite well with the biological component. We're good at infusions and we've got that all handled, but these other things we're struggling a little bit with. And if you can find a better balance in all 4 areas, you tend to do a little bit better. Let me just say one thing about the spiritual realm. Now, this isn't necessarily that you belong to a church or that you believe in anything specific, but this is where you look for greater meaning in life. And people who have greater meaning in life, connection to humanity, to nature, whatever it may be for you, that tends to help individuals cope better. And so I'd encourage you to think about the spiritual part of who you are. And again, if it's a connection with God or a higher power, that's fine. But how do you make sense of life? How do you recharge your batteries, because that area tends to get overlooked sometimes, and it can be quite problematic. So let's talk about, we've talked about the problems, let's talk about some solutions and finding some keys and ways to deal with this and make it work a little bit better for each of us. So we'll do a poll here. So what's your favorite thing to do as a family to relax? Exercise, watch a movie, talk, or eat?
We'll launch that poll now and give everybody a few seconds to vote. Give us another 10-second countdown. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And let's see what our results say. 57% of the audience likes to watch a movie, and then we're equally split amongst the other three. Exercise, talk, and eat each get 14% of our audience's votes.
All right. So I think movies are a great way to escape from life. One thing I would like to challenge all of you on is movies aren't necessarily interactive, so find some way to make it interactive. Talk about it, look at reviews beforehand, talk about the movie afterwards, that's fine. But maybe also think about some things that can be more engaging as a family. That's one of the biggest changes that we've seen in family functioning over the last 20 years is that people aren't doing as good a job of actually engaging. And with the digital age and with cell phones and laptops and iPads and iPods and whatever, that connection tends to be getting a little bit worse. So make sure that you're balancing it out. It's okay to watch a movie sometimes, but then go for a walk as a family or go for a hike or a picnic or something. So thanks for answering that. And then just want to talk about family coping in general. Sometimes we forget that coping is kind of an individual basis. So I have to figure out what I'm going to do with my mood. I have to figure out how I'm going to deal with the stress at work and home and whatever. But there's also a family coping strategy that as we pull together, we can actually be stronger by supporting one another. And that's kind of the ironic thing that some people who are struggling, for example, older gentleman with hemophilia that has some chronic issues with pain and arthritis and whatever, and sometimes we find that the wife just doesn't feel like she can share any of her burden with him because he's already burdened enough. And what we found is that actually the male in this situation actually feels better because he can do something to support his wife as she's supporting him. And so sometimes that burden aspect, that we probably should get rid of that, and that we can learn how to mutually support one another instead of I have to be the one always in charge, I always have to be on, and it's okay to lean upon each other. And it's also kind of a times and seasons things, right? There are times when you may be down and your partner or your kids may be up and it may roll around, but if we look at that family coping, it can really make things work a little bit better here. Now this one's really hard, and I don't know anything about the gender dynamics of our group here, but putting your health first is often a really hard thing to get people to do because you can't help anybody else out if you're out of the game yourself. And so you have to find times and ways to take care of yourself so that you can continue to serve whatever capacity that you feel like you need to do. So please don't forget to put yourself first, just to make sure that you have the basics, that you're sleeping as much as you can, getting the exercise, eating, taking care. Sometimes moms especially, they're the last ones to go to the doctor because everybody else is already gone. But just make sure that you're taking care of yourself first so that you can continue to do what you want to do. So here's another poll. What percentage of your time do you spend taking care of yourself each week? So some examples of this, and whatever fits you. working out, meditating, going out, chatting, relaxing, reading, whatever it is that you feel like is taking care of yourself. The options are 2, 10, 25, and 50%.
That poll is now launched for the audience to vote. Just out there. I'll give a few more seconds here. Which I can only do a 5-second countdown tonight. 5, 4, 3, 2, 1. See what our results are. Let's see, 57% of the audience says they give themselves 25% of their week. 14% give themselves 10% per week, and 29% give them 2% of time per week.
Okay, so if you're on the bottom end of that scale, your challenge is to find a way to move it up a little bit. And nobody knows what the perfect percentage is, but if you're feeling ragged and worn out by the end of each day and you haven't done anything to refuel your gas tank, find something to do. Even if it's only 5 minutes, you can do it. So the other thing that I want to talk about is creating a village for you, because one of the big issues that play a role in dealing with chronic illness, whether it's in your spouse or yourself or your kids, is that who do you have to support you? And I think that's why HFA is so important, why our local chapters are helpful, because you have that village around you to people that know what you're going through and can support you. But you also have to have individuals that are closer to you. Maybe you only are able to do your chapter events once a year or twice a year, or maybe once a month. But what do you do on that week that you need somebody? So make sure you're finding people that you can call and reach out to just talk about what's going on for you. And this is especially true for those who may be a single parent, because what we find with single parents is they don't have a built-in support system, and that's where the kids oftentimes get turned into kind of a pseudo support system, and kids just aren't emotionally capable of dealing with that. And so it's really important for you to find somebody, whether it be your mom or the neighbor or a best friend or somebody in the chapter, that you can call at any time. There's like open door policy so that the kids don't get pulled into it, because they really emotionally can't deal with it. And we deal with those kids a lot in therapy, that they keep trying to help and almost play a spousal role with their mom or dad, and it just doesn't work very well. So make sure that you're creating that village for you. It's another way for you to take care of yourself, and then you kind of have a built-in support system. If you want to go out for the night or do something, you have somebody you can turn to. So some of the learning some coping strategies, and I think this is the one that I really want to stress, that I'd like you to think about things that you can do in each of these categories, because stress comes at different times of the day, and so you may have time for a 30-second break to deal with you're going to the hospital, you're ready to go in and find out what's going on, and so you take a 30-second break, you breathe, you're kind of mindful of what's going on inside of you, and you go forward. And you can take a 30-second break multiple times during the day. So just kind of check yourself, what's going on, evaluate what's happening and why you want things to be different. 5-minute breaks, a little bit more time. I've worked with lots of people who are in an environment where at work they don't have anywhere to go, and so they'll go into the bathroom. It may sound gross, but they'll just go into the bathroom and put the lid down, sit on the toilet for a couple minutes to kind of reset themselves. 30-minute breaks. This is a huge thing, especially for professionals, is that they never leave their desk even for lunch. They eat through their lunch hour, and taking that 30-minute lunch hour, they've proven that people are more productive by taking that small lunch hour break than if they were to work through their whole lunch hour. 2-hour breaks, of course, that often looks like a date night or something like that, or getting away with the girlfriends or with the guy friends. Taking a day off where you can just kind of recoup and redo things week in and week. So think about all levels and how are you doing on each of these. And not everybody has the luxury of taking a week's vacation every month, but have you had a week's vacation in the last 2 years? And if you haven't, how could you make that happen? So think about all these levels, because a lot of times people get discouraged that I can't do the week break, so therefore I'm not going to do anything else. Start with the things that you can do that you have control over, because you do have more control over it than you think. So attitude, as we've mentioned throughout this presentation, plays a huge role in it. So, you know, attitude determines altitude. It really helps us figure out where are we going to get, because we are able to look at what efforts we're going to put into this. Attitude is everything. And so this is the kind of birds that we want to look at. What's your attitude? Are you soaring through the sky over the mountains and seeing everything that's going on and enjoying the process? Are you stuck on the ground as a flightless bird like this turkey here? And some of you may be this flightless bird here in the bottom corner now. But so think about that. What is your attitude doing to impede you from being really who you want to be? And there are strategies that can be done to change that. So here's another poll. What's the thing most associated with your negative thoughts? Inadequacy, feeling overwhelmed, failure, or hopelessness?
I'll launch that poll right now. Give everybody a few more seconds here. And I'll do a 5-second countdown. 5, 4, 2, 2, 1. See what our results say. 67% feel overwhelmed is affecting their negative thoughts, and then 17% say inadequacy, and 17% say hopelessness.
Okay. Thanks for doing that. So feeling overwhelmed, again, this is where the attitude comes in, and what are some things that you can do with how you look at what's going on in your life? So maybe work's really busy, but is it something that you love doing? Or is it something that's providing for your family? And so that change in attitude can really make a difference in reducing that feeling of being overwhelmed and the hopelessness. And inadequacy is a problem for all of us, right? We're trying to do the best we can. None of us was given a specific training course on parenting or how to cope with life. And we were just given this new baby and you're supposed to figure it out. And a lot of times we feel like we're not doing very well. So one way to make our lives better is by controlling how we think, as we were talking about that. The ways that we can accept the challenge of the bleeding disorder and explain why our body may be doing what it's doing can have a better outcome on our emotions. So it's really kind of changing that way of thinking. So one example is, oh my gosh, here we go again. I can't deal with this. This is going to do me in. And you can see that, but that's kind of how some of us talk. And some of us are like Eeyore. That's the first thing that comes out of your mouth. Versus, you know, this sucks, but we've done hard things in the past. We can do this also. The fact that my body is reacting the way it is will help us find a way through this moment. So you can see it's the same experience, the same encounter, but the way that we look at it really makes a difference on the outcome. Because, again, we don't get choices on some of the things that we're confronted with. So a few things that I just want to briefly talk about, these cognitive distortions. these are the automatic patterns that kind of get us in trouble a lot with our thoughts. And so this is kind of the all or nothing thinking. Everything is black and white. So it's either sunny or it's rainy. There's no kind of normal days. Things have to be really good or they're really bad. I wake up in a bad mood, so the whole day is shot. Overgeneralization, this is where, things just, we have one bad thing happen and that's the end of it. Disqualifying the positive, anything that bad happens, it's supposed to happen. But if anything good happens, that's purely accidental, has nothing to do with me. Jumping conclusions, magnification, should statements, and personalization is a huge issue, especially for some carriers that, I own this because I created that, and that doesn't lead to any positive outcomes. So these cognitive distortions, and you can Google these, there's hundreds of them, but I'd really encourage you to kind of look at this, and what I usually have clients do is print this out and go through it and find out what are the ones that I do a lot of, and then what are the ones that I do all the time. And that way, if you start having that thought, you can catch yourself and saying, oh my gosh, I'm overgeneralizing again. I got cut off in traffic. The rest of my day isn't shot to hell. Everything can be okay. It doesn't have to be a bad deal. So I'm not going to overgeneralize at that point. So just one strategy of controlling our thoughts can be helpful. And here's another way of looking at this. This is kind of the ABCs they talk about in the activating event. So again, somebody cuts you off in traffic. Oftentimes it feels like the automatic thought is that you're angry and you want to run them off the road. And I know some of you out there, that's the kind of person you want to be, right? But truthfully, what really happens is somebody cuts you off in traffic, you have this belief, which sometimes is affiliated with these cognitive distortions, that lead to that consequence. So if somebody cuts you off in traffic and the belief is, I'm not involved in this and he isn't worth it, the consequence could be that you can relax, turn up the music, and let the nice man drive away, and you don't even have to signal him with any fingers on your hand, but you can just go forward there. So something to really look at is that belief system. How do you make a difference in the beliefs that you make from something happening in your life? So your child has a bleed, your belief is, oh my gosh, we can't do this. Well, the consequence is you're going to go into that gas pedal mode, and you really need to be putting on the brake and saying, okay, we've got to make some sense of this and figure out what to do about it. So why would you want to do this? It's more fun to run somebody off the road or flip them off or whatever, but truthfully, most of the time, people tick us off. The only person that really suffers from it is us. So grandma was mean to you as a child, or your dad was mean to you as a child, or whatever. Sometimes we have to realize that the person that harmed us isn't hurting anymore. I'm the only one hurting, so we need to do something different because we deserve it to be different. So changing your thinking, just a quick review. Your child has a bleed after his first day of school. The belief is this is how it's going to be, overgeneralization, or how am I ever going to cope with this, magnification, and the consequence is sadness and worry. Whereas the other way is your child has a bleed the first day of school. The belief is things like this happen, we'll figure this out. The whole school year isn't shot just because of the first day of school happening. And the consequences, there's concern, problem solving, and everybody can kind of relax. And I know it sounds simple to say it, but you also have to find a way to actually make it happen in your life. The other part that I want to talk about, the thoughts, and I think this is the last one about thoughts, is just really kind of looking at those negative thoughts, those cognitive distortions, the things that slow you down in life. We need to start identifying them, stopping them, and replacing them with something more important. So if you're thinking that you're overwhelmed or you're worthless or you're hopeless, maybe it's time to put the big stop sign up and say, okay, I'm having that thought again. I don't have time for that. And replace it with something more positive. What is more important in your life than beating yourself with a stick? Well, maybe a vacation that you want to plan, even though it may be years down the road before you could do it. Or hanging out with your family that night. Anything. that can be replaced to get rid of that negative thought can be really helpful. Because self-talk can be our worst enemy. We're the worst. We say things to ourselves that we would never say to anybody else. You know, some people are jerks out there. They may say it to other people and never say it to themselves. But a lot of people say the worst things ever to themselves, and we need to be nicer. And if you wouldn't say it to somebody else, don't say it to yourself. Get rid of those thoughts. So one more quick poll. When or where do you find the most time to relax?
I'll watch that poll now. Almost 100% of our audience voting. Give it another few seconds here. See what those results say. 50% say before bed is when they find the most time to relax. I would personally agree with that too. And then we're equally split with 17% saying in the morning, in the car, or in the bathroom.
All right. Yeah, the bathroom tends to be a refuge for especially moms with little kids. Sometimes you have to make sure the kids are safe. You crawl behind the door, you shut it, you sit behind the door, and you sob. And you just try to put yourself together, and then you go back and take life back on. But the key here is to try to turn things into relaxation time for you, because you already have to do it. I lived in Nebraska, and I commuted about 35 minutes a day, and I would get home furious because work was tough and the traffic was horrible, and it was awful. And finally it dawned on me, it's like, we have 35 minutes in the car, you can choose what you do with the time. And so I started singing, and I started listening to my favorite music, or I'd listen to a book on tape, or I'd call somebody. And it was amazing how I turned something that was so stressful into relaxation time. And I'd really encourage you to find ways to take advantage of things that happen anyway. So you might as well, you know, if you're in the shower, take 2 more minutes in the shower and really kind of soak up that hot water. Before you go to bed, maybe you take some time to go for a little walk. Whatever it is, but find those times to steal them away for your benefit. And it's pretty amazing how just that thought process can turn a lot of things that are normally mundane, like washing dishes or folding clothes. Those seem to be tasks and tend to be mundane, but you could turn them into something where you can relax and think about something more positive. Okay, so I just want to touch base on mindfulness. So this is where that being judgmental of ourselves and always on ourselves and not really finding ways to relax. Well, mindfulness is the opposite. It's where we're able to just accept that things are happening around us, and we're not going to judge it, and we're not going to be mean to ourselves, but we have thoughts and emotions and sensations that are happening, and we're just going to pay attention to them. And it's okay. And this is something that can be really helpful when you're in the hospital, because if you're just sitting around waiting anyway, find some time to close your eyes and just say, you know, there's not much I can do at this point. How can I just be connected and just wait? Slow things down a little bit. So mindfulness gives you time. Time gives you choices. Choices skillfully made lead to freedom. You don't have to be swept away by your feeling. You can respond with wisdom and kindness rather than habit and reactivity. So just one way of thinking about it, that we get to choose our response to whatever happens in life, and we forget that a lot. So at the end of the presentation, and you can go back and look at this, I give some resources on ways of relaxing and breathing and those sorts of techniques. And the nice thing now is YouTube has a lot of them on there. So I think there are songs or music or rain or whatever that will play for 9 hours for you if you need to relax. And so finding those things that help you relax. And let me talk about one specific one. And I want you to all kind of do this as I know it's kind of weird that you're sitting in front of your computer, but nobody's looking at you, nobody's looking at me. So I want you to kind of sit in your chair, and we're going to kind of focus on the relaxation part. So I want you to take a nice big deep breath in through your nose, and then slowly let it out through pursed lips. So kind of pucker up as you do that. And I just want you to nice and slowly take another nice big deep breath in. One more nice big deep breath in. And let it out. And I know that's just a short experience, but those of you who tried it, you can see that this is a proven way to kind of bring down the stress in your body. And so breathing techniques like that, if you practice them, you can use them when you need them. So a lot of times when people are stressed, they're like, oh my gosh, I need to do deep breathing, but they've never really practiced it. So people that are struggling a little bit, maybe you want to take 5 minutes in the morning, 5 minutes at night, again, stealing that time for yourself, and just focus on your breathing. Focus on relaxing thoughts, and allow yourself to retrain your body to be okay with being relaxed. That way, when stress is high, you can sit in a hospital chair, you can do your breathing exercises for 30 seconds, 45 seconds, kind of recenter yourself, and you're ready to take on any doctors or nurses or whatever you need to do. So just one way of looking at that. So this was a study looking at what makes a difference in allowing people to relax, and what they found is this progressive muscle scan. So kind of checking your body to make sure that there's nothing really stressed. So starting with your face, to your arms, to your chest, to your shoulders, to your legs, just kind of checking, make sure that you release some of this tension that may be there. The breathing that we kind of already did and practiced just a little bit can be helpful. And then the other part is this repetition. And what they found here is just to find one word that you can kind of chant over and over again to just keep your mind occupied enough that it doesn't think about something else. So these 3 steps have been proven to help, but the reason why it doesn't work for some people is they don't practice it when they're not stressed. So try it out, and you can find this on the internet, the Benson relaxation response. The other thing that I'm just going to mention, if we were in person, I'd show some video clips here, but laughter plays a huge role in this. So hopefully those of you who said they're watching movies, you're watching funny movies where you're gut busting laughing, because there is some really good evidence out there that laughing changes our internal systems, and it allows us to relax. So try to take some time and laugh, and find ways to relax, and to you know, maybe you have a favorite show that the days that you're really stressed, you have it saved on your DVR, and you watch that to give yourself some laugh there. Just some funny things I came across here. Frosty gets caught picking his nose, touching the wires causes instant death, $200 fine. And you can see the baby there, just happy as can be that he found somebody special, and it's actually him. And I'd really like you to think about that as look in the mirror and be happy with who you are. You know, you have strengths and you have weaknesses, but spend some time thinking about who you are and what you contribute and the good things about yourself. Just to touch base on this really quickly on counseling and medications. If any of the things that we talked about you feel like you're just not getting ahead of, that's where counseling and or medications can be helpful. And that's something that you can look at starting with your family doc if you need one, or I'll give a website where you can find a therapist in your area that kind of works with these sorts of things. But if you keep trying to and things aren't getting better, it's just getting in the way of your ability to function, just go and do something about it. Don't wait, because the people who come in proactively saying I'm not doing very well are actually much easier. The treatment is shorter and they're much more effective than those who wait for 10 or 5 or 20 years before they do something about it. So just in review, if we can start acknowledging that we do have storms in our lives and we don't get to choose them. So we have to decide what we're going to do with it. Be nice to yourself. Really kind of develop that positive attitude about your experiences, about yourself, about your family. Control those negative thoughts. Find the positive things that really make it worthwhile living. And be mindful and relax. Laugh, and best of all, try to find ways to be happy. Because there's a lot in life, in spite of the struggles, that can make us happy. And here's the website that I talked about. If you need to find somebody in your area, you can put in your zip code. It will give you therapists. It's therapistlocator.com. That deep breathing video, if you Google relaxation response video exercise, meditate by Peg Bame, she'll walk you through how to do that. The progressive muscle relaxation, again, take 5 progressive muscle relaxation. If you Google that, it will pull up the YouTube video. And then the relaxation response by Benson really talks about how you do that. So I'll leave this up just for a couple, just about 30 more seconds in case you want to take this down. And I believe you can look at this webinar in the future and pull this slide up again if you need to. But as I do that, I want to thank you for your time today. Hopefully you found something. And the challenge that I give all of you is take something from what I've said and try it on. Everybody can do something a little bit different, whether it be changing your thoughts or getting some exercise or finding 5 minutes to take care of yourself. Anybody can do something a little bit better. And that's our challenge here. So I really thank you for your time, and find that one thing that you can do to decrease the stress that you have in your life, and go forward and have a good evening, and feel free to contact me if I can be of further help. So thanks so much, everyone. Have a good night.
Thank you, Dave. I'll follow up by saying that HFA will be sending out an email tomorrow to all of our participants with a link to evaluate tonight's webinar. It really helps us at HFA when we get feedback from the community about tonight's webinar and future topics that you'd like to hear about. So you will get that link. And in that email, I will include the information on your resources to everyone too, Dave. So that will be easy to access.
Thank you.
And go ahead and put that in the email. We did have one question come in that I wanted to relay to you, and that is, what if it's hard for you to reach out to people and vent to get support? As caregivers, sometimes people just hold it all together all the time and don't want to bother anyone with their problems. So what would your advice be to that person that submitted that question?
Can you say the first part? I didn't quite hear the first part.
Yeah, so it's hard for this particular person to reach out to other people and vent to get support. And they just kind of hold it all in all the time and don't want to bother anyone with their problem.
Yeah, you know, that is probably the most common problem that we deal with, is everybody wants to take care of everybody else, but nobody wants to be taken care of. And so I think the best strategy is to just try something that you feel like you could reach out with somebody. So maybe you're not going to bare your soul to someone else, but can you call them up and say, you know, today's kind of been a rough day, and I don't know what your night looks like, but could we go out and get some ice cream? So it doesn't have to be a big thing, but you're kind of putting yourself out a little bit, saying, you know, I kind of had a rough day, but starting to have those conversations so that people can realize that you're somebody that they can lean on and they're somebody that you can lean on. That's a really positive thing. And most people who don't want to burden anybody else, they never really give anybody else an opportunity. And if you were to ask any of their friends or family members, they would be more than willing to support you, but they don't think you ever need help. And you know, our hemophilia moms are really good at that, of taking care of everybody else but not taking care of themselves. So try the little things. Don't just opening up and telling your whole life story to strangers isn't going to work for you, but you can find a simple thing that will allow you to reach out and just test the waters, and you can realize, hey, that wasn't that bad, and I didn't really have to even divulge a whole lot. I just said I was struggling and I needed a break. So that would be one strategy that I would recommend.
I have to share this. Another audience member just typed in and said, my daughter just heard ice cream and said she's willing to go with anyone that needs an ice cream break. And I think that's just so typical of the bleeding disorders community. We really do care for one another and rally around one another. So always feel free to reach out. Definitely, Dave is available. I'm not a licensed therapist, but I'm a hemophilia mom too, and always willing to lend an ear to anyone that wants to reach out. So just putting that out there. Any other questions or comments from our audience tonight? We have just a few minutes left. We are a little bit over, but that's okay. Again, another one of those hemo mom lessons. You learn not to watch the clock too much. But we'll give it just a few more seconds here to see if any other questions come in. I will go ahead and mention we will have another families webinar coming up on July 21st. The topic that evening will be about inhibitors and what you need to know. So really a inhibitor 101 for anyone who is curious to learn more about inhibitors and what that means for the bleeding disorders community. If you got the email informing you about this webinar, you'll certainly get an invite to that one too. Seeing no other questions, Dave, I'm going to go on and wrap us up for tonight. I want to thank Dave. Dave is a very popular HFA family speaker, and we thank him for his time and expertise. Always enjoy hearing you speak, Dave, so thank you for your time tonight. Again, thanks to the audience for participating. As I said, you will get an email with a brief survey just to tell us how we're doing and to give us feedback on other things that you want to hear about. And I'll include information about those resources that Dave currently has on the screen. And with that, I thank you all.